Hello, and you're welcome to yet another video about non-communicable diseases. In this video, we'll talk about NCDs and mental health and how they can be integrated into HIV care. I want to begin by thanking the Ministry of Health, Uganda, AIDS Control Program, and the President's Emergency Plan for AIDS Relief, US government PEPFAR agencies for supporting the HIV response in this country. And I must say that I am not the official spokesperson for any of these agencies. This is just a video continuing medical education, targeting health workers to raise awareness and aid the implementation of NCD integration into HIV care. Now that the disclaimers are out of the way, let's step right into it. I'll begin by giving a background about HIV in Uganda. Currently, we are over 40 million Ugandans, and our HIV prevalence stands at 5.5%. What does that mean? 5.5% of Ugandans aged 15 to 49, that's the reproductive age, are estimated to be living with HIV, and this translates to 1.4 million Ugandans, of whom 1.3 million are taking antiretroviral therapy. So we have about 100,000 Ugandans out there who are living with HIV but have not yet been started on treatment. Now, the challenge is as we continue living longer and we're having more and more increasing number of people living with HIV growing older, which is a good thing because people are surviving longer. There's an increasing number of non-communicable diseases that are beginning to grow and crop up in this population. So we need to integrate NCD care into HIV care. So, for example, if we look at last year, over for persons aged 50% and above, they constituted 20% of the people living with HIV. So that's significant. However, we have not been very good at this as health workers. The interventions to integrate NCD care into HIV care have rarely been implemented, and it's this that prompted the Uganda Ministry of Health AIDS Control Program and other scientists to roll out a study pilot in 2020-2021 to integrate NCD care into HIV care. So when we talk of NCDs, non-communicable diseases, what do we mean? These are diseases or medical conditions that are not infectious. In other words, they cannot be transmitted from one person to another. And these diseases usually have a gradual onset. They start slowly, and they tend to be long-standing or chronic in nature. When you hear the word chronic, it means something is standing for a long time. So I want to mention also that I will try as much as possible in this video to simplify things so that everyone can understand as much as possible. So bear with me if I sound overly simplistic, but it's very important that we move together. So NCDs are often associated with lifestyle factors, such as unhealthy diet, eating a lot of junk food, lack of physical activity. We call it a sedentary lifestyle. We are always seated in the offices, seated in the traffic jams. Then you get home, you sit on the telly, no physical activity. Tobacco use and smoking, consumption of tobacco, excessive alcohol, and other risk factors which increase the risks for non-communicable diseases. They are significant global public health concern. NCDs such as cardiovascular diseases are actually among the leading causes of death among human beings. They contribute to a substantial proportion of global disease burden, killing people, what we call mortality, and also morbidity, increasing the effect or the burden of disease on humans. These NCDs include hypertension, diabetes mellitus, mental illness or mental health concerns, cervical cancer. Cervical cancer integration into HIV care has been around for some time, and the program for cervical cancer screening and management is fairly mature. It's not doing badly, but now we want to bring on board these other NCDs like hypertension, diabetes, and we integrate them strongly, including mental health, into HIV management and care. And there's another emerging challenge of obesity and weight gain. I mentioned that we are increasingly sedentary, we are not mobile, we are not doing physical activity. People are putting on weight because we are eating a lot of junk food and not exercising. And also some of the drugs like dolutegravir have been associated with obesity, so it's also a big concern. There are similarities between HIV and these non-communicable diseases. Both conditions, when we look at their prevention and management, there are similarities. For example, in both cases for HIV and NCDs, we promote healthy behavior, lifestyle changes. The patient has to be involved in the management, in that we have to give patients health education. Patients should be aware about the condition and be involved in decision making. In both cases, we need community and family support for adherence to the drugs, because remember we said this is lifelong, or they are usually chronic. So they are both chronic conditions, and we will need lifelong support from the community and family members to help the patient take the drugs, and also to avoid stigma in the households and in the community. Continuous follow-up is important, checking on the adherence, checking on the safety, and checking on the response, whether both conditions are being controlled. Then long-term adherence to medication and regular monitoring. So the objectives of this video and this program generally for NCD integration is to support identification and timely management of people living with HIV who have comorbidities or who have specifically non-communicable diseases. Someone has HIV, but they also have either hypertension, diabetes, mental illness, or both, or all the three possible. And then to support management of NCDs as part of long-term retention and epidemic control sustainability, given the aging HIV, aging population of people living with HIV. So people living with HIV are growing older, and as part of the sustainability plan for HIV care, we need to integrate NCD care and provide guidance on standardized integrated model for management of NCDs among people living with HIV, with a clear M&E plan for monitoring program improvement. So why should we integrate NCD care into HIV care? I've already alluded to some of this. It will improve the quality of life of the people living with HIV. And we have an aging population of people living with HIV who need to be taken care of, not only on the HIV side, but we need to manage the NCDs. It would be sad if we achieved viral suppression, managed the HIV very well, then somebody died of a heart attack from high blood pressure, or somebody suffered from depression, has poor mental health state. We need to be holistic. It will make us efficient in that the same health worker is managing all these conditions. So the patient does not have to keep making multiple trips to the facility. One trip to pick ARVs, then they go home, come back another day to pick antihypertensives, antidiabetics, antipsychotics. It will all be integrated. And in that case, costs will be saved, time will be saved. And we also know that HIV itself and the ARVs which we give can predispose to non-communicable diseases. I already talked about dolutegravir being associated with obesity, but also HIV can damage organs in the body like the kidneys, and in that case predispose somebody to high blood pressure, for example. It can disrupt glucose control, blood sugar control mechanisms, and result in diabetes mellitus. So we need to integrate the two. So the goal is to provide and to support health workers at all levels in the community, whether health center, 2s, 3s, 4s, hospitals at different levels, the district hospitals, regional referral hospitals, national referral hospitals, all health workers to support service providers plan and implement multi-layered interventions in line with the recently released Consolidated HIV Guidelines 2022, so that we reduce mortality, reduce morbidity from non-communicable non-communicable diseases among people living with HIV. The strategies that the ministry has put in place for this to be implemented, there is the implementation guidelines have been developed and institutionalized. We are looking at strengthened capacity through training and mentorship of health workers to identify and manage non-communicable diseases. And then the supply chain should also be secure. Supply chain strengthening commodity security so that the items we require, the blood pressure machines, the glucometers and glucometer strips, the screening forms and charts, the medicines are available. We also need the M&E system, the reporting, monitoring and evaluation systems, information management, that we should be able to report all the interventions and even analyze the data, conduct evaluations to see whether the integration is on track. So let's look at the models for integration. We have three big models for integration. The first one is what we call the parallel services. Parallel services is the first at the top, where the HIV services are separate from the NCD services. The HIV clinic, anyone with HIV gets care in the HIV clinic. But if you're there in the HIV clinic and they discover that you have a non-communicable disease, they refer you to the NCD clinic, maybe hypertension clinic, diabetes clinic. So they are separate. You have parallel services. And this is what has been happening in most of our health facilities. Hypertensive patients are seen alone. HIV patients, patients with HIV are seen alone. But what we are promoting is scenario 2 of coordinated services, intra. It is the preferred model at this time, that the HIV clinic integrates NCD services. So both HIV and NCDs are provided, those services are provided within the HIV clinic. Screening, management, treatment, reporting are all done in the HIV clinic. And then there's another model called the integrated services model, which is a more mature or more advanced level of integration, going to be started at regional referral hospitals. In this model, you have one chronic care or chronic disease services clinic, where everyone, regardless of HIV status, whether you're HIV positive, you're HIV negative, regardless, as long as you have a chronic disease, hypertension, diabetes, mental illnesses, and other chronic diseases, chronic obstructive lung disease, regardless, you all get care under one roof in a chronic diseases clinic. You're treated, you're provided follow-up services, the data is recorded and reported. All things are integrated into one clinic regardless of HIV status. So that is a more mature form of integration. But for now, what we are promoting is scenario 2 in the majority of our health center, 2s, 3s, 4s, hospitals, that the HIV clinic be the point of integration of these services. And what do we need in place to make sure that the implementation of NCD HIV care happens? For the coordinated services, we need human resource who are trained. Health workers have to be knowledgeable. We need the logistics. We need the BP machines, the glucometers, glucometer strips. We need the reporting forms, the screening tools. We need the medicines to treat HIV, medicines to treat NCDs, that is the antihypertensives, antidiabetics, antipsychotic drugs. We need information systems that are integrated. The HMIS, Health Management Information Systems, have to be integrated, that they capture both the HIV and NCD data. And then the service delivery should also be integrated, like I mentioned, one-stop shop, that the HIV patient who has NCDs is treated within the HIV clinic. At the same time, the HIV clinic should coordinate or collaborate with specialist clinics. Sometimes you might find a patient who has complications that you need to refer to a specialist. Say in some hospitals and health centers have specialized hypertension clinics. So much as we are treating this patient for HIV and hypertension in the HIV clinic, if there is a complication where we need to coordinate or collaborate with the hypertension specialist clinic, we should be able to work together and refer where need be. So the tools, like I mentioned, we need BP machines, whether the digital BP machine or the mercury column, or mercuric blood pressure machine, which comes along with a stethoscope. We need glucometers and glucometer strips, weighing scales at triage with height measures so that we can calculate the body mass index, BMI. We need medications to treat all the conditions. We need antihypertensives, antidiabetics, antipsychotic drugs, and of course the ARVs. And we also need the monitoring and reporting systems, M&E systems for monitoring and evaluation, to record and analyze the data on integration so that we can see a positive trend in the integration of NCD care into HIV care. So every health worker has a role to play at triage. The triage nurse, even expert patients and peers, can provide health education about NCDs. They can screen for risk factors for NCDs. So there are screening forms for screening for risk factors, screening risk factors for hypertension, screening risk factors for diabetes, and screening even for symptoms of mental illness, and then document. But the clinician goes ahead to do an evaluation, take history, physical exam, and then request laboratory investigations. When they are positive or they show abnormalities, make the diagnosis, institute treatment, prescribe the medicines, request for further management of complications, that's further with a U, and then document screening, diagnosis, and treatment in the relevant registers and forms. Documentation is key. Document on the blue card, document in the EMR if you're using point of care, electronic medical record system, electronically, and then also document in any forms and other registers as need be. And then for the laboratory technicians, they conduct the laboratory tests requested, they take off samples for phlebotomy, they order lab supplies and document in the daily activity register. The data officers enter the information in the electronic medical record system, compile reports, conduct performance reviews, and report the NCD data alongside the HIV data. So that is it for now. We'll take a short breather, and that's the introduction to the NCD care. So I will go into, this is going to be a 4-part series, and the first part we've done is to introduce the NCDs and how they can be integrated into HIV care. So in the next video, I'll talk about hypertension. We're now looking at one NCD, hypertension. Then another video will talk about diabetes, and in another video we'll talk about mental health and how these can be integrated into HIV care. So let me pause for now. Thank you, and see you in the next video. Thank you for that. Stay safe and take good care.